President Director of Orthopedic Hospital Surakarta, Indonesia. On this occasion, I would like to express my gratitude to King Mongkut Institute of Technology at Prapang, Thailand, especially Professor Chayanin Angthong and DFT for being our honored guest lecturer on this webinar. This international guest lecture is an event to commemorate the opening of orthopedic and traumatic research program in our state. As the only national orthopedic referral center owned by the Indonesian government, we were appointed by the Indonesian Ministry of Health to establish the first ever hospital-based orthopedic and traumatologic research program in Indonesia. Department of Orthopedic in Mongkut Institute of Technology at Prabang have an important role in our program formation. In the future, we hope Soeharso Orthopedic Hospital Surakarta can also send our residents or faculties from another subspecialty to learn from such a world-class university hospital. We are looking forward for another future cooperation and collaboration in research or patient care between Soeharso Orthopedic Hospital Surakarta and King Mongkut Institute of Technology and Prabang, Thailand. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Romanianto, for those encouraging words. We truly value the support and the research technology. Now let's begin the main part. It is a big honor to introduce our expert speaker, Professor Chayanin Angthong, medical doctor, PhD. Professor Chayanin is not only an orthopedic surgeon, but also a global academic leader. He serves as the head of the Department of Orthopedic at KMC Hospital in Bangkok, Thailand, and is dedicated researcher at the College of Biomedical Engineering and Medicine, Rangsit University. His educational background is truly world-class also. He earned his medical doctor from the Faculty of Medicine, Sirat Hospital, and then got the PhD from the Faculty of Medicine, Fukuoka University, Japan. He completed prestigious fellowship at Duke University and New York University in the USA and was named an AUFAS Traveling Fellow in 2017. Combining this deep clinical and international experience with his research in artificial intelligence makes him the perfect person to guide today. So, Professor Chayanin, thank you very much, Professor, for sharing your valuable time and knowledge with us today. And now the floor is yours, Professor.
Thank you very much, Dr. Hasmina, and all colleagues, and also thank you to your kind invitation for me to be here, and also very warm welcome for me to this meeting. So I would like to share my screen for the for the lecture. Okay, so today I would like to talk about artificial intelligence or AI in the management of the common musculoskeletal conditions and orthopedic surgery. Okay. Okay. Here I would like to have the opening slide with the quote from François Pina. He is a captain of South Africa Rugby Union team of Springboks in 1995, and he lead his team to achieve the champion in that competition in the World Rugby competition at that time. And he said at that time about time change, we have to change as well. It means that sometimes we have to change our mindset to the change of the ecosystem around us. And I think this idea changed my mindset to the new technology like artificial intelligence in this new era, to adapt ourselves to the new technology. So for the outline of my talk, I will talk about the introduction of AI, why do we need AI, and common conditions and use case that I have the experience about that. And I will touch some level about the generative AI, and also I will summarize about the further developments and the AI application in the real world. So for an introduction, why do we need AI? So here I would like to show you the word singularity or the transcendence, the same meaning. The singularity means the capability of computer or the artificial intelligence that can achieve the same level of the human intelligence or can achieve more. So this term was coined by this guy. This guy is the Hungarian American scientist who helped IBM to produce the early version of the computer in about 1950 to 1960, about that. And he said, he coined this term, and he predicted that in the future, if the computer can develop more and more, it can achieve the same capability as human in terms of the intelligence, and it can achieve more. So after that, you can see that the computer develop more and more, and the human intelligence develop in million years, achieve gradually development. But computer can achieve the same capability from the beginning just about 1950, and it has the steep curve of the development quite quick, and it can achieve the same capability at about 2023, and it can surpass the capability of human. Like you can see here, very high steep curve above the human intelligence. So what should we do for this thing? We should adapt ourselves to the artificial intelligence or machine or computer intelligence, and we adapt our experience as the human, our feeling, our knowledge to it, and use it to be beneficial as much as possible to help for the caretaking to our patients. And this thing we call the transhuman approach. So I think we should perform like that regarding this curve. And you can see that in the details, the computer developed more and more, like you can see here. And in 2023, it was predicted that the computer intelligence can surpass brain power of human. But in 2023, in 2045, the computer may surpass our brains combination of intelligence. It was predicted like that. So that's why we need to develop ourselves and adapt ourselves to the computer intelligence to use the benefit from it. But when we want to see the reason why the artificial intelligence can have the good capability, I would like to show you this slide that the artificial intelligence combine the human brain and experience from several doctors like this, from the radiologist, from orthopedic surgeons, from ortho doctor who is the expert. And these doctors train the AI or the AI model by the teaching of AI to know, for example, this project of mine that to predict what is the level of intervertebral disc degeneration in the MRI. In the MRI, and the radiologist or myself will train the AI or labeling the level of this degeneration, and it will turn to the black color. And after that, we train it like 500 pictures, for example, and AI will learn more and more from our experience, and it will accumulate it to be the model, and then you can test the model from unseen pictures of the MRI, and you can see the performance of the model that was trained from yourself, from your team brains, your team's knowledge. And you can see that the AI can predict interpretable disc degeneration with very high probability in the bounding box like this. And this is the number of probability of AI confidence. And this idea, if you compare to the conventional concept that you will diagnose interpretable disc degeneration by yourself alone or by single radiologist, the single doctor has the limited experience, has the limited training experience. So he or she can have only the limited experience from by himself or herself, and it can have some limited capability, and it will have the chance to have lower capability of knowledge than the AI. So this is the concept. That's why AI can be trained more and more to have higher capability or the singularity compared to the human. So I would like to show you the common conditions that I start to review to make sure that AI can have the capability like that. So I start from the polytrauma cases, that what is the role of AI to detect or to provide the benefit in the case like this. So I perform the systematic review, that I perform literature review first, and after that I gather the studies in terms of systematic review study, and then I accumulate and analyze the data. After that, I start to produce the model for the AI to use in the daily practice. And this is the milestone of the AI systematic review about the polytrauma beneficial thing from the AI. And I use the PRISMA criteria workflow like this. We identified the studies about the polytrauma artificial intelligence, and then we perform screening and make the eligibility of the studies in accordance with the criteria here. And we include the 8 studies and perform analysis and summary for the knowledge application of the AI. And we found many studies are from the USA, like you can see here. And 6 studies are about the non-military trauma or civilian trauma, and 2 studies are about the military trauma. And we extract the data from the eligible studies, and we collect overall patients, about 25,000 patients. And we found the benefit of AI in terms of 3 categories. First category is about trauma identification of the patient. And the second thing is about mortality and all survival predictions. And the last thing is very important, that it is the quite common of AI benefit. It's about to predict the shock or make the decision of shock and management. So the last thing is very important in our patients with the polytrauma about the shock management, and AI provide the beneficial appreciation quite well in this entity. And for the AI models, they use most common model. They use machine learning, followed by deep learning and natural language processing. And for the performance, we found that most AI provide a good area under the curve or AUC, and which is quite good performance. And another model may be excellent capability regarding the AUC curve. So in overall, it's quite good to experience of the performance of the AI in this study. I would like to show you that this is the good study in this systematic review, that the AI can help you to determine the bleeding in the pelvic fracture, as you can see in the red color. It's really good that it can calculate for you from the computer tomography pictures, and you can predict that the patient need the blood replacement or volume replacement or not, regarding that investigation with AI augmentation. And this study is very good that they can calculate the chance of the mortality of the multi-organ failure, ARDS outcome, VTE, and transfusion regarding the time change at the hours after injury. It is the dynamic calculation and dynamic analysis from the AI. So it's very difficult for the human to predict like a dynamic change of these parameters. And it is good for us to use this thing to predict the, for example, mortality and multi-organ failure that we have to tackle with it regarding the time change. So this is a study that I correct the data about that, and I report like a systematic review with this publication. And after that, I think after I know the knowledge and benefit from AI, now I move to focus on the degenerative conditions and related trauma in orthopedic surgery. So for the first thing, early thing that I try to use the AI is about the fracture. And this is the hip fracture that is common in Thailand because the aging population is started in Thailand. So I developed the machine learning model training, and I produced the machine learning on the website, on the online platform we call RoboFlow, and we can detect the hip fracture or intertrochanteric fracture in the bounding box like this, in the green box. And for the pink box, it is the normal bone or intact bone, differentiate from the fracture, as you can see here. And I try to correlate with the blood loss that we may calculate regarding the fracture. And in accordance with this study of the amount of blood loss, and this machine learning model can use in the mobile phone. We can use it, upload the picture or take a picture, and we can detect it by the mobile phone. And I validate it that should we believe the performance of AI from myself or not. So I compare the interpretation of the fracture with the general radiologist regarding the time of the diagnosis and also the diagnosis correctness. So we found that from the confusion matrix study, we found that AI compared to the general radiologist, surprisingly, the sensitivity, specificity, and precision is comparable or better than radiologists, and also with the accuracy. And with the shorter time of diagnosis, as you can see here, AI can give the diagnosis with the mean time about 3 seconds, but the radiologist use time about 26 seconds. So the AI can provide the diagnosis quicker than the radiologist about 9 times, with the comparable or better performance. So this is the singularity can occur already in this study. That is the example. The another example is that we use in our study about the patient with back pain, and we train the AI, as I showed you previously, to detect intervertebral degeneration, and we found good results initially about the precision and accuracy about 80%. And we develop more and more by another model we call deep matrix learning, or DML, compared to the object detection. And we found that you can see that the precision of the deep matrix learning model to detect intervertebral degeneration is very high, about 95%. And compared to the traditional model like object detection model is about 92.6%. Both numbers are good, and I think precision about 95% is almost comparable to the radiologists or at least general radiologists. So this thing show the good result of AI can achieve very high capability of diagnosis of intervertebral degeneration in the MRI. Next thing, I use the AI for the detection of knee osteoarthritis. As you know, the patient with older person has the repetitive use of the knee in the cadaveric model. In the cadaveric specimen, you can see here that they will have the eburnation or joint erosion of the knee joint, as you can see on the right side and on the left side. In your view, is about 43 years old. The knee is quite well. So after that, after the degeneration, the joint space can be narrowing in terms of the chain and in accordance with the chain in the MRI, in the X-ray. So we developed the AI to be the model to detect the normal knee normal knee in the X-ray compared to the knee osteoarthritis in the X-ray. And we train the model to classify the non-severe severity and the severe severity in accordance with joint space narrowing and in accordance with Kelgen-Rollins classification. And we found a good result that the accuracy of our model achieved about 85 to 86.7% of the accuracy to diagnose the knee osteoarthritis. And this number was comparable to the accuracy number of orthopedic surgeons in previous study. So I think this thing will help us to have quick diagnosis, quick classification of the knee osteoarthritis, and let us have less burden in terms of the knee X-ray interpretation, and help us to have the more confidence to diagnose and maybe to have the proper treatment in accordance with the severity of the knee osteoarthritis. And the next thing I would like to show you the AI technology that I developed in my expertise, like a foot ankle surgery. And this thing is the machine learning models that my medical student and me and my team help to develop the models to classify the Halak valgus classification in accordance with the Manchester scale classification. Manchester scale classification is correlated quite well to the X-ray severity. So this is the Halak valgus grade 1, this is grade 2, this is grade 3, and this is grade 4. And the machine learning models that we developed can classify quite well when we combine two models together. We combine the Robo4 model and teachable machine model, and we found a good result as if Robo4 can detect the intact foot quite well with 95% accuracy. However, teachable machine can detect moderate deformity very well, about 86%. When you see the graph of the combination, the blue one, the light blue one shows 78% to detect mild deformity. On the other hand, the red colors show the teachable machine accuracy about 86% for moderate severity class and 69% for the severe severity class diagnosis. So I think we can develop more and more. We may develop more and more to have higher capability of the detection and classification of the Halak valgus by the clinical image. And I also developed the model that can detect high foot valgus in the patient with the flat foot, like a static standing like this. You can see in the yellow bounding box that this is the flat foot patient with the high foot valgus. You can see the lowering of the arch over here, and it can detect it quite well in this picture from the AI model that I developed by the way that I mentioned previously. I achieved the more than the static diagnosis. I moved to the dynamic analysis. I use the position of the patient and I train to detect hip, knee, ankle axis in the video analysis of the patient during the gait, like a gait analysis, video gait analysis. And we can detect the position of the femur of the knee at the knee area and at the ankle area, like a valgus femur and valgus foot and valgus femur and the valgus foot during the gait, during the walking. And you can detect the abnormality before the surgery and also after the surgery. Before the surgery, you can plan for the surgery that you want to correct the deformity that you want. And for the after surgery, if there is some residual deformity or residual abnormality of the motion, you can advise to the patient or the physiotherapist to help correction of some muscle after the surgery. For example, if the patient still have the hip adduction during the foot, that will be the landing during the gait. You can let the patient to have more hip abductor training to have more stability of the walking, for example. And for the video evaluation, we train more and more to have the involvement to the sports medicine. I would like to show you, this is very new study of mine, and I try to train it better than this version. I would like to show you that we start to produce the model, AI model, to detect the motion in the video of the football game. And we want to have the match analysis, like a prediction of the results of the match, and also the tactical analysis, like a heat map of the players in the field, that he play well in accordance with the tactic that the coach gave them before the game, and the individual player performance, and also the physical care that the individual player run a lot, run how many kilometers per game, and it may convert it indirectly to energy use of each player. And here is our just the beginning of the model. I think we should develop better than this. You can see here that we can detect the player to send the ball, and when he can pass, this guy pass the ball to this forward, and it can detect and make the shooting and make the goal. And nowadays we can detect the player right now, and we want to develop more and more, like I said. And if you talk about the current use nowadays in the Bundesliga or the German football competition, they use the Amazon Web Service for the AI model to detect the game facts, over 3.6 million data points per match. And you see that there are very huge amount of data points that we should analyze. So AI works very well, I think, work quite well for this thing. And you can see here that they use the football analysis like this, especially the shot speed. They can identify the player, and when they shot he shot the football, it can calculate the speed of ball, and it can reflect to the player performance, and also it can help to evaluate the performance of the goalkeeper also, because Granit Xhaka shot very quick ball, like 124 kilometers per hour, I think, and the goalkeeper can save the football, even the very quick ball speed. So this thing is very good for the nowadays use, and for the future, for the training in football also. And I would like to touch the last thing about the generative AI. the generative AI, I think many of you use it. I also use the many generative AIs in my practice and in my study. And I produced the study about, shall we always believe generative AI, such as ChatGPT responses all the time, especially about the medical things, orthopedic things. So I performed the study, this study, and I report it in the peer ref, and I asked the artificial intelligence chatbot or ChatGPT that about the flat foot management. What is the role of the AI, and can the AI help in the flat foot management? After that, I putting the same question and find the results from the PubMed and Europe PMC to compare the findings from ChatGPT and findings from the literature review results compared together to see what is the overlap of the real thing or of the believable things from ChatGPT comparing to the literature review results. And I found that we use semantic analysis to show the overlap of the knowledge from AI, ChatGPT, and the literature review results. Only two items like diagnosis and classification or personalized treatment planning has moderate to high overlap of the contents. But for other things from the ChatGPT are not validated yet from the literature reviews in terms of the quality score, and for the quantity scores, with almost it's quite the same trend that only diagnosis and personalized treatment planning and classification has the low to high level of the overlap of the contents between ChatGPT and the literature review findings, but there is no overlap for other items. So I think if we receive the answers from the ChatGPT or generative AIs, we should use it cautiously, and we should validate it by the expert or by your knowledge as the expert before we use that response, that answers to our patient. So for this is the picture. This picture is our AI and robotic lab in the King Mongkut Institute of Technology, La Krabang. Is still my collaboration with my university, and we develop AI and the robotic training over here. And for the summary, I think these AI models may enhance a previous model to improve care in orthopedic and musculoskeletal patients. And I think there are many, there still have rooms for the improvement of AI in the daily practice in orthopedic surgery, especially the deep learning models. And I think near-term development should focus on clinical correlation in our practice. Practical interface. The interface should be practically and user-friendly to use for the doctors, and we should prove the utilization of the real-world application, especially to provide the less morbidity or mortality, and for our patients, provide less burden to the doctors and healthcare providers, and provide more accuracy of treatment and prognosis determination of our treatment to the patient. Thank you for your kind attention.
Thank you, Professor Chayanin. Oh, very clear, very informative lecture. Thank you very much. The information you shared on how to diagnose, classify the disease with artificial intelligence, and then even predict the bleeding, and also analyze the best rehabilitation, Professor. Wow, it was especially great. Now it's time for the Q&A session. Yeah. We see a question in the Q&A box, Professor. The question is, how can AI be utilized to predict perioperative risks in orthopedic surgery, such as the need for blood transfusion and then the likelihood of post-operative infection or the risk of the fracture non-union? Professor, please.
Yes. Very good question. I think we can use AI to train to answer these questions quite well. First of all, for example, if you want to develop the model to detect, to predict the need of blood transfusion, you can collect the data from your previous patients. For example, you may have to focus the surgery first, that what kind of surgery that you want to make this prediction. I would like to make the example of total knee arthroplasty. If you have the patients with total knee arthroplasty, about 100 patients, and you collect all data about that retrospectively, and you put that data like the time, operative time, operative blood loss, the experience of doctor, the severity of the deformity, the model, the implants that you use, and you put it to the model, train the model to know what many factors that you put, and the model can you train it to calculate what is the factors that predict the blood loss from that study. The study, the machine learning can develop in the statistical analysis to show that what factor is the real factor to predict the blood loss as the end result. After that, when you have that model, you can test your model performance with the another set of the data, like maybe separate the 50 patients data, and you can test your model with the new data that your model has the accuracy or not. Actually, it can be done quite well by the machine learning model. Yes, and also the same training can predict the infection also, or the fracture non-union as the end result by the factors that you collect from the patients previously. Yeah.
Yeah, that is a very helpful advice from you, Professor. Thank you. And then there is a next question from the Brian. In the future, can artificial intelligence replace the human surgeon, Professor? It's interesting. And how about the legal and ethical aspect of medical use of AI currently in Thailand?
Okay, thank you for the question, Brian. It's a good question. Can AI replace the human surgeon? I think AI can be the good assistant for us. It's difficult to replace the occupation that need to touch the patient, like the surgeon, because it's really quite difficult nowadays that AI can perform, like to perform the surgery or to touch the patient, to have the procedure with the patient. So in this thing, AI will help us for the diagnosis, for the planning, and for the augmentation of robotic surgery. But as the human or the expert like us as a human, we have to control it or supervise the use of AI nowadays. So I think nowadays is not the time that AI can replace us, but it can assist us very well to reduce the burden of the time to use for the patient, and let us have more confidence of diagnosis or procedure planning or the prediction of the outcome. And for Thailand, nowadays we have the law uh, to to supervise the AI, that if we use the AI for the diagnosis that we start to use in some hospital, finally we have to the doctor with the license have to confirm the finding from AI first before the use of that finding to treat the patient. For example, if my AI model can detect hip fracture, I have to confirm it again that, oh, okay, that is the real hip fracture, and then I will proceed to the surgery, for example. So we have the law right now. Yes.
Yeah, so AI should be our partner, Professor. Yeah. It's
Yes.
not our enemy, right?
Not enemy, like a friend, colleague. It's
Yeah.
like a colleague. Yes.
Okay. There is also question, Professor. There are many actually. So the next question is, yeah, from Abdurrahman. Is there any special AI website that has been established for orthopedic purposes, Professor?
Oh, okay. There is the AI platform for the medical imaging training. Not only orthopedic surgery. We call Monai. I will type for you in the chat. You can go to see it in the in the in the website, the Monai, the MONAI. It was developed from the King's College, London University, with NVIDIA. You know NVIDIA, right? NVIDIA is the big company that produce the GPU. And then they work together to produce the medical platform to develop AI, uh, especially in the medical things. And I think they may have the pre-trained model for the orthopedic surgery. And but if you don't want to use it, you can use another model that I will type for you. It is quite easy to use, and you can develop your model by yourself. It may have the pre-trained model also we call LoPo. It is the machine learning model. The Monai is the deep learning platform. You can learn and you can use it for the development. Yes.
Yeah, that's clear, Professor. And then there is also a question, can AI tools can assist with triage and prioritization of orthopedic trauma cases in busy emergency setting, Professor? If can, how it can be works?
Okay, very good question. In America, that I in the US that I review in my systematic review, one study use the AI for triage and prioritization, and they use the technique that we call the natural language processing, or NLP. I will type in the chat, NLP, natural language processing, and the doctor or the we call emergency medical service, like a EMS or ambulance personnel, when they went to pick when they go to pick up the patients, some personnel may take care of the patient, and some personnel may put the data from the scene, accident scene, or the event scene in the computer, and the computer will calculate this thing like a vital signs, blood pressure, or the status of the patient, airway, something like that, in the computer during in the ambulance, and this thing will send to the hospital to let the hospital know before they receive the patient at emergency room. After that, the computer with the natural language processing or the AI can make the triage automatically before the patient arrive at the ER, at the emergency room. So this thing was started in the US, especially in the military trauma, in the soldiers trauma, because they need to prepare the blood for the blood transfusion for the patient, and they know before the patient's arrival. Yes.
A very good insight, Professor. We switch to the next question. Professor, is there already AI used for the deformity correction program, Professor?
Oh, okay. Yes, that's very good question. Actually, I start to develop this model right now with my team. It is the good way to use AI for deformity correction program because you can have the X-ray and you can have MRI or CT imaging before the surgery, and it is the elective case. You can have time to prepare for your plan, and you can train this AI model by the training. You can put many like 100 pictures or 500 pictures of the deformity like as you want. For example, the knee deformity, you can put it in the AI and train it to see the reference point of the deformity. After that, you can let your programmer or your data scientist to know the goal of your deformity correction. For example, if you want to correct from knee valgus to knee neutral, you let the AI know it that this is the deformity, and let your data scientist to make the equation or the AI technique to learn how AI can change from valgus to neutral deformity. And after that, you train the pictures to the AI. I think it's possible to develop this thing. But first of all, we have to train AI to know deformity first. And after that, we can have the next step for the goal of deformity correction and let the AI suggest us that what is the area of the osteotomy, what is the area that we should fix the external fixator like a Taylor spatial frame or it is a loft, for example, like that. It's possible, yes.
Okay, thank you, Professor. We have time for maybe one last question about the future. Yeah, maybe in 5 years, which area in orthopedics, Professor, like spine or trauma or joint replacement, do you predict AI will change the most?
Oh, okay. I think AI will have developed a lot nowadays in the knee. Actually, in the knee osteoarthritis, a lot. You can see nowadays they can make the automatic diagnosis of the knee osteoarthritis severity. And I think in the area that it is common in the population, it will develop more and more and quite quick. I think knee and spine will be developed a lot and it will be settled. It can achieve the standard of the AI use in 5 years, I think, for the knee and the spine. In terms of the suggestion of the surgery and in terms of the surgical planning, even the total knee replacement or the spinal fusion, I think nowadays it can develop more and more to predict the outcomes of the surgery. I think this is very important point that we need, and I think in 5 years we can see more and more and quicker than other modality. The second modality may be about osteoporosis and the hip fracture that we need to help the patient because it's critical to treat this kind of patient. Yes.
Perfect. Professor Chayanin, thank you again. Your expertise has truly made this morning inspiring, Professor. Before we finish, let's take a quick group photo. So please turn your camera on to all the participants and give a beautiful smile for the documentation. And for the team, please, all the participants, give your beautiful cheers. Yeah. Okay. Everyone is ready. So 1, 2, 3. Okay. Perfect. So thank you, everyone. Your participation today shows the orthopedic community wants new ideas, innovation, and better care for the patient. We hope this seminar was helpful and you feel more ready for the future of artificial intelligence in our field in orthopedics. If you are interested, so you can visit the Soeharso Orthopedic Hospital and also to the Thailand, from Surakarta to Thailand. And to all of you, thank you and have a good day and a very successful week. Thank you, Professor Chayanin. See you.
Thank you so much. Thank you so much.
Thank
Thank
you
you,
so much.
Achan.
Terima kasih.
Terima kasih.
Terima kasih.